This week, Texas Attorney General Ken Paxton warned Austin, San Antonio, and Dallas to loosen coronavirus restrictions. His office even indicated there could be some litigation if cities don't pull back their stance on masks and sheltering in place, religious services. How does that warning speak to this battle playing out between state and local control in Texas?
Yeah, it's an ongoing battle, and the pandemic isn't immune from it, if you will. And yeah, it's basically that in the beginning, the governor, did not issue any sort of statewide orders, instead deferring to these big cities who were taking action to, limit the spread of the coronavirus. And now the governor, and by extension, the attorney general, says that the governor's word trumps any local restrictions. And, these local leaders, including here in Austin, up in Dallas, and over in San Antonio, say that their restrictions are being mischaracterized and they're actually in line with the governor's orders. So again, the tussle continues.
Lawmakers and health experts argue that testing is going to play a key role in businesses reopening. Coronavirus tests are supposed to be free, but some Texans are still getting hit with these large bills. What's happening there?
Complicated insurance stuff that permeates every aspect of healthcare, and that this pandemic is no exception. People are seeing large bills because maybe they were tested or saw a doctor before March, when much of the legislation took effect and became applicable to cover people's not only their COVID tests, but the tests that doctors would do to eliminate, if there was COVID. So, heart screenings or flu test and things like that. And so you see in our reporting and talking with United Healthcare, obviously one of the bigger companies, that they are trying to work with patients and be retroactive in their application of waiving certain fees and whatnot, so people aren't stuck with these large bills.
All right, Alana Rocha with the Texas Tribune. Thanks for being with us.
Thank you.
And here's a look at local case totals in our area. We are still waiting on updated numbers from Travis County, but as of yesterday, at least 2,288 people have been infected in all. Statewide, we set a record for the largest single-day increase in deaths and a record for single-day increase in cases, although that also coincides with a major testing increase.